So today we're going to share latest on a number of issues around the public health response and vaccinations for COVID-19. And as the Minister says, on Thursday we'll be providing a modelling and epidemiology update as well, so people are aware of where we are. As people have noticed, last week we were doing some updating and clarifying of provincial health orders, and one of those was updating the PHO order on mask wearing in indoor public places. And I've often spoken about the importance of the layers of protection that we have and how masks are one of those important layers. We need to continue to use masks in all of our indoor public spaces, at gatherings and events and at schools, and that order remains in place. And the requirement and the order will be in place until we've determined that we're at a place where the risk of spreading COVID-19 has been significantly reduced. So this order extends the order and clarifies where masking is required, particularly in some of the clarifying some of the issues around events and gatherings and how important it is now that we've increased capacity in many of those events and gatherings that masks be a part of how we continue to safely get through this next phase of the pandemic. I also want to mention that while not under the order specifically, I want to highlight the importance of wearing masks in faith services. We have developed in partnership with many faith leaders across the province guidance for faith services and how to safely have faith services during this period of time. And it becomes even more important that this guidance is followed as we're heading into respiratory season. We have seen transmission of COVID-19 in faith gatherings, and in some cases that has meant that those gatherings have had to go remote. And certainly in the northern health area where we have increased transmission in communities, we've gone to all remote faith services for now. This is especially important as we move into the colder winter months and spend more time indoors, and as we start to enter the full respiratory season. Last year, as many people know, was the result of our high level of influenza immunization combined with the precautions that we have been taking. We had no influenza cases. This year, we have already started to see influenza here in the province and other respiratory illnesses. But just last week, we had our first confirmations of influenza A here in BC. So this just reminds us how important it is to continue to take these levels of precautions, particularly in indoor settings. And I also remind people that it is time to get your influenza vaccination, and that this is available particularly through pharmacies across the province. It is also important as we head into this respiratory season in great depth that not to lose sight of the fact that when we go somewhere, we bring that risk with us. And COVID-19 can be the unwanted package that comes with us. So the restrictions we have in place and the actions we take as individuals are not only about protecting ourselves and those we are closest to, but also protecting those in our community and reducing the impact on our healthcare system, which, as we know, is very stretched around the province. With this in mind, I want to remind everybody that it is now a requirement for visitors at any of our acute care facilities across the province to be fully vaccinated. I know that we have guidelines and provisions are, of course, made for parents of children, for people who are pregnant, and for people in palliative care. But additional precautions will also be needed in those cases, and our protections must be end-to-end to provide maximum protection for people receiving care, to healthcare workers, and to those caring for all of us. I know last week as well, we clarified the Provincial Health Officer order around the BC vaccine card, and we closed one of the loopholes that had been brought to our attention that was causing some concern for many of the sports organizations. It's important as we move indoors and as we align our vaccine card requirements that we closed this loophole that allowed coaches of youth sports or people who volunteered with youth sports not to be fully vaccinated. So now that is a requirement. It is unfortunate that we needed to do this. As you know, we've continued to put importance on stressing the importance of youth sports and making sure that we're minimizing the barriers around youth sports. And initially, we knew that most coaches and volunteers were vaccinated, but unfortunately, some people were taking advantage of that not being required, and it has led to transmission. We have transmission that happened in a sports event where a number of teams came together, and some of the adults spread the virus between them, and that spread into children who then brought it into schools. So this means we all need to take a step back and recognize the important role we play as adults in protecting children, particularly those who are too young to be vaccinated right now. So we have been working very closely with Via Sport and the many leagues supporting youth sports around the province. And it was at their request and in discussions with them that we put in the requirement for those people who are now working with young children, whether it's as a volunteer, a coach, leading or supporting youth sports and activities, that you now must confirm proof of vaccination to continue in those roles, particularly as we move into indoor sports over the next few months. This requirement for proof of vaccination means we can keep these important youth programs safely going and keep our children safe. Last week as well, we announced that booster vaccines have been expanded to everybody on a program based on risk. And we know that for the most part, we started already with long-term care, with seniors in our community, with people who have compromised immune systems. And the data has also shown, as we've presented, that individuals who received 2 doses of AstraZeneca have had a waning of protection from infection. Thankfully, they still have very strong, good protection for serious illness, but lower protection against infection. And as a result, people who receive 2 doses of AstraZeneca will be receiving invitations for their booster dose at 6 months. And this may be sooner than other healthy adults in the community where we know there's very good, strong protection that's lasting well. So those people who receive 2 doses of AstraZeneca, you can expect to receive your invitation for a booster dose in the coming months, depending on how long it's been since you received your dose 2. And I will say the booster doses will be with an mRNA vaccine, and that combination, particularly a viral vector and an mRNA combination, has been shown to be very effective and long-lasting. Finally, we also will be clarifying a number of the other provincial health officer orders in the coming days. First, the food and liquor serving premises order. We've heard from a number of different restaurants and food premises that they would like more clarification on the requirement and expectation for those premises that are what we're calling quick serve counter service, so the counter service only model. And although we are not requiring them to check the BC vaccine card, there are expectations about numbers of people, about spacing and distances and barriers and other things that need to be in place to ensure that those premises are safe as well. And additionally, we're working with the colleges, the regulated health professionals, to ensure that regulated health professionals in the community are also vaccinated. As you know, we have a mandatory program for healthcare workers in our health system, and this is working closely with the colleges, particularly physicians and nurses and dentists, to make sure that we are all protected so that we protect ourselves, our colleagues and our offices, and the patients that we care for. As you know, we're working to protect those who are at highest risk, and I am grateful particularly to everybody who has the millions of people throughout BC who are doing their part as well. It is your simple efforts of getting your COVID-19 and your influenza vaccination, staying home and away from others if you're feeling unwell, getting tested, cleaning your hands regularly, that will make all the difference. We have all made sacrifices in this past almost 22 months, and we have felt the impacts of COVID-19. It is doing these things now that help us get back to those important activities in our life and help us do it safely and mitigating the risk of this virus impacting our families, our loved ones, and those we don't know. It's with this compassion and care that we will get through this next few months as well, by being kind, being calm, and being safe. Thank you.
Thank you, Dr. Henry. And in today's update, I'm going to address a number of subjects. Just see what they are. Be addressing the proof of vaccination requirements for the BC Public Service, the healthcare worker proof of vaccination requirement, which was brought into place last Tuesday for healthcare workers across the system, an update on booster shots in long-term care, an update on acute care capacity levels, and an update, the usual updates on surgical and on contact tracing numbers. But before I begin all of that, I wanted to thank BC's Chief Coroner Lisa Lapointe for her report on the heat wave experienced this summer. The Coroner Service, of course, will complete its investigations through the beginning of 2022, and a death review panel will provide recommendations in the spring of 2022. As people will know, in the healthcare system, and the Chief Coroner reported through the period, principally the period around June the 28th, or June the 28th to July the 2nd, but also through that period that 595 people passing away, which is extraordinary. You will know that on June the 28th, during this unprecedented heat wave, BC Emergency Health Services received 2,000 ambulance dispatches, which is the highest ever received in one day. The efforts of everyone in the healthcare system to respond to the heat wave, including and especially frontline workers and those in public health, were remarkable. But the impacts, as we all know, as we see by today's report, were tragic, and the loss of life devastating. It's vital that we learn from these events, and that's exactly what we will do, and we'll be following very closely the independent review being conducted by the coroner. As you know, we're also beginning with that work already, in particular with our ambulance service. We announced new measures. We've already announced new measures to strengthen BC's ambulance service to ensure it's faster and more responsive to British Columbians. It's a better place to work for paramedics and dispatchers that can meet changing demands and needs. From 2017, we've invested extraordinary amounts in BC EHS. With the exception of mental health and addictions, it's the area of healthcare that's received the most increase in support since 2017. Its annual budget's going from $424.25 million to $559.12 million a year. We're reinforcing ambulance operations with hundreds of new paramedic positions, including the 85 announced in mid-July, 30 new dispatchers, 22 new ambulances, with the dozens of rural and remote communities that are seeing an increase in service, particularly full-time paramedics. And we expect to fill these positions this month. Some are filled, rest will largely be filled this month. These actions reflect our commitment to the health and safety of British Columbians and the ambulance paramedics they are counting on. We also know in order to manage heat waves, we must all work together on many core issues, from housing affordability and safety and infrastructure, income inequality, municipal supports and services, and of course, at the center of it all, climate change, on which BC is a world leader, but we must continue to work together. We are taking significant steps, extraordinary steps on all these fronts to prepare for future events. Dr. Henderson, Dr. Sarah Henderson of the BC CDC, we're leading our own review of these events, and with the Provincial Health Office has noted this is a 1 in 1,000 year event. It has now happened. It's no longer a 1 in 1,000 year event. It's a 1 in 1 year event, and we need to respond and become more resilient, not just as a health system, but as a province. I wanted to update you on the Public Service Agency's vaccinations. Several weeks ago, we told you of the coming requirement for all those employed by the BC Public Service to be vaccinated against COVID-19. The BC Public Service showed leadership and set an example for other employees by requiring all those employed by the BC Public Service to be vaccinated. Here's where the effort stands today. Employees who do not provide proof of vaccination or refuse to disclose their vaccination status by November 22nd will be considered unvaccinated. Public service employees who do not have at least one dose of the vaccine by November 22nd, where there is not an approved accommodation based on a medical condition or other protected grounds, will be placed on unpaid leave for 3 months. Partially vaccinated employees, those having received only one dose, may be offered alternative work arrangements and will be required to provide proof of vaccination, full vaccination, within 35 days of having received their first dose. Partially vaccinated employees who are not fully vaccinated within that timeline will be placed on unpaid leave. Employees who are still unvaccinated after the 3-month unpaid leave may be terminated. This is a necessary step to support vaccination and help protect all our workplaces and communities from COVID-19. We know the vast majority of people are already vaccinated with at least one dose. Over 12, that number is 89.9% today. And I thank all public servants and all British Columbians who've made the decision to get vaccinated. I also want to thank everyone who works in the BC Public Service for the work they've done over the last 2 years, showing the highest level of professionalism and dedication during these unprecedented and difficult times. With respect to mandatory vaccinations for healthcare workers, I want to bring you an update as to the numbers there. We have 127, excluding long-term care and assisted living, 127,448 total healthcare workers in BC. That's people who have worked at least one shift in the last 3 months. As of today, 122,000, or as of, should I say, yesterday at midnight, 122,059, or 95.8%, are fully vaccinated. 2,064, or 1.6%, have received one dose, and 3,325, or 2.6%, are not yet vaccinated and on unpaid leave. By health authority, just to put that in context, and there has been some improvements, as you'll note, in these numbers over the last number of days. Across the health authorities, unvaccinated numbers in Fraser Health are 2%, that's 587 employees. In Northern Health, 4%, or 320 employees. Vancouver Coastal Health, 2%, or 478 employees. Interior Health Authority, 5%, or 1,018 employees. Providence Healthcare, 1%, or 104 employees and staff. And in Vancouver Island Health, it's 2%, or 480. Again, these are people who, across the board, who worked at least one shift in the last 3 months. So it doesn't represent FTEs, but it is obviously a significant challenge. Principally, it's been a challenge in the Interior Health Authority. You'll know that this week, 2 operating rooms are down in order to respond to the staffing challenges involved. That will be reduced to 1 next week, and we hope all will be restored in 2 weeks. That has a real impact there. There's some impact on lab times and responses. And in a community such as Karamias, where a large percentage of a relatively small group of people in the facility there mean that hours are being adjusted in Karamias. None of this is desirable. It's necessary. And Interior Health and all of the staff in Interior Health in particular are doing an excellent job in responding to these circumstances. With respect to long-term care, as of yesterday, 93% of facilities of long-term care and seniors assisted living facilities in the province, 93% of facilities have received their booster doses to date for residents. That's 491 out of the 536. They are completed in Vancouver Coastal Health and Northern Health. There are 15 remaining in Fraser Health, and they'll be complete by tomorrow. In Island Health, 100 out of 117 are complete, with the remainder to be completed this week. In Interior Health, 126 out of 139 sites are complete. The remainder will all be completed this week, but as we see, the work is substantially done, and I am very appreciative of our teams, of our vaccination teams, and everyone working in long-term care for this effort. We wanted to get it done, largely done, by the end of October, and that has been achieved. We're doing the rest in the next few days. On May 7, 2020, we made our surgical renewal commitment to patients. Since then, through successive waves of COVID-19 and other provincial and local challenges that we've encountered, we've adhered to that commitment. We've never wavered from this promise. We've never stepped back from its key touchstone, that every patient whose surgery is postponed will get another call, one that tells them that their surgery is being rescheduled and they will get the surgery they need. Every patient whose surgery is postponed will get the surgery they need. On Thursday, I'll report on our surgical completions and postponements, just as we have done since May. Across BC, the vast majority of our operating rooms continue to run, but due to a variety of challenges, there have been some reductions, as you know, as we've described, particularly with the challenges in Northern Health, as we know, and in Interior Health. So today I'll go through the current status of operating rooms across each health authority. Here's where we stand. Kelowna General Hospital, as I've discussed, has reduced 2 operating rooms this week to compensate for staff who did not meet vaccination requirements who are on unpaid leave. This will improve next week with just 1 operating room reduced, and then we hope in 2 weeks the situation will improve further. Kelowna General Hospital has postponed non-urgent eye care procedures in the eye care center in order to respond to critical care surge planning needs. At Royal Inland Hospital, a number of inpatient surgeries have been postponed. The number will be reporting on Thursday, and replaced by same-day surgeries to support the current demand for critical care, which, as you know, in Interior Health is high. In Fraser Health, a very small number of surgeries have been postponed as a result of staff who do not meet vaccination requirements, but no further postponements are expected. Abbotsford Regional and Royal Columbian Hospital each continue to reduce 1 operating room due to ongoing demand for critical care. This is part of the reductions we've been talking about for some weeks now. Abbotsford Regional will focus on same-day surgeries that don't require a stay in hospital for November due to demand for critical care in COVID-19. In Vancouver Coastal Health, no surgical postponements have occurred as a result of unvaccinated staff. Ongoing demand for critical care and staffing pressures have reduced a number of operating rooms for an extended period of time. These include 2 operating rooms at Lionsgate Hospital, 3 operating rooms at St. Paul's, 1 operating room at Mount St. Joseph's, and 1 operating room at Richmond Hospital. Plans are in place to resume surgeries in these operating rooms beginning in the new year at Richmond Hospital and in February at St. Paul's, Lionsgate, and Mount St. Joseph's. In Island Health, no surgical postponements have occurred as a result of staff who did not meet vaccination requirements. At Nanaimo Regional General Hospital, non-urgent surgeries continue to be postponed this week, with some resuming next week, November 8th. 1 to 2 operating rooms will continue to be reduced daily at the hospital to support the ongoing need for critical care. Royal Jubilee Hospital will continue to have 1 operating room reduced through December 17th to support, again, critical care demand. Victoria General Hospital has resumed non-urgent surgeries. In Northern Health, no surgical postponements have occurred as a result of unvaccinated staff. At Bulkley Valley District Hospital, day-to-day surgical postponements continue in order to support critical care. Dawson Creek Hospital is prioritizing urgent, emergent, and cancer surgeries to support critical care capacity and increasing COVID-19 admission. Fort St. John Hospital is prioritizing urgent, emergent, and cancer surgeries to support critical care capacity and increasing COVID-19 admissions. UHMBC continues, and Prince George continues to have reduced surgical operations, but is expected to increase to 4 operating rooms starting November the 8th. At Prince Rupert Regional Hospital for the month of November, operating room staff are being redeployed in the emergency department due to staffing pressures. At the PHSA, the Provincial Health Services Authority, no surgical postponements have occurred as a result of unvaccinated staff. BC Children's and BC Women's will experience an impact on some future surgeries due to the upcoming implementation of the Clinical and Systems Transformation Project designed to improve safety, quality, and consistency of patient care. Finally, when it comes to contact tracing, over the past week, an additional 33 staff are reported as supporting contact tracing for a total of 1,575 as of October 29, 2021. This exceeds the number of contact tracers we had reported for the 3rd wave of the COVID-19 pandemic. The highest number reported at that time was 1,563. Finally, since September 5th, 92 Northern Health patients have been transferred to ICUs in other health authorities. That's 92 people, all critically ill, who've been transported away from home during the most challenging of times. These numbers show just how critical it is that each of us takes all the steps we can to reduce the pressures on our healthcare system in the north and across BC. And finally, just on the overall numbers in our healthcare system, we have, as you know, in public healthcare, as we've reported many times, 9,229 base beds in our healthcare system. We've added 2,353 surge beds in the system for a total of 11,582 beds. As of today, in our base beds, we have 8,840 people, meaning 389 base beds that are available. In our surge beds, we have 478 people in those surge beds, and that leaves 1,875 available. So we have across the healthcare system, and this has increased 9,318 people across the public healthcare system right now. I want to thank everybody working in healthcare in these difficult and challenging times for all the work they're doing. That 9,318 is slightly less than it was, say, in December of 2019 in a busy period for healthcare. But with two public health emergencies and the challenges that are brought for being in the midst of a pandemic, we are taking actions every day. That's why these steps are being taken with respect to surgeries in different places in order to ensure that we can provide adequate and appropriate care to people in critical care. But I have to say this again, finally. Everyone who can be vaccinated in this province, and that's basically everybody, needs to get vaccinated. We are seeing and continuing to see a massive number of people, massive share of those in hospital with COVID-19 are those who are unvaccinated. And this puts pressure on everybody, on our entire healthcare system. 89.9% of people have been vaccinated. More than 85% of people who got both doses of the COVID-19 vaccine. Over 120,000 people have received a booster dose. And we need those numbers to still be higher. I'm asking anyone who hasn't been vaccinated today to contact our numbers and to book an appointment, either through our website or alternatively by calling us directly. It is important now as ever. We need to continue to work together to protect one another from COVID-19. We're happy to take your questions.